Good morning, everybody. My name is Nick. I'm with IU5, and currently we are working on getting Karin connected. So we ask if you have a little bit of spare time to give us a minute. We're trying to connect with Karin. We're having some technical issues. So hold on. We're working on getting that taken care of. Thank you for your patience, guys. We're working with Karin right now. We're having some technical issues. She had an emergency that popped up, and she has to be connecting from her vehicle. So, in the life of a CRNP, Certified Registered Nurse Practitioner. We appreciate your patience, guys. We're still working with Karin on this, trying to get her in. Okay, I just got a message from Karin. She is transitioning to her office. So she's had an emergency this morning and she was trying to connect with her phone. And she's going to be moving up to her office, and hopefully we're going to be getting her here soon. We appreciate your patience. Okay, looks like we have Karin joining us right now. So, well, we're going to get rolling. Karin, I'm gonna push you over to our content here in a second, but we do have Karin Wickwire with us. A bit of a crazy morning, but she is a certified registered nurse practitioner, and we're going to just go with an adapted model here. We'll do 15 minutes of chatting with Karin, and then we're going to open it up to question and answer from our audience. So we'll have about 15 minutes of that. While Karin's talking, you'll notice whether you're viewing this independently or you have it projected, somewhere on your screen, whether you're using a Mac or a PC, there's like a little chat bubble with a question mark in it. Feel free to throw any questions into the chat portion in the question and answer. And as we get those questions towards the end, we'll read them over to Karin, and then she'll be able to answer some of those questions for you. So Karin, I have you on audio. Are you ready?
I am.
All right, so let's switch this over. And we're going to put you as front and center. All right, Karin, you gotcha. Thank you for your flexibility. So let's start off right away. As you're a CRNP, Certified Registered Nurse Practitioner, and you had a mess this morning.
I did have a little bit of a mess.
That. So the hustle and the bustle. What? Share with us. What was it, if you can?
Well, we have been, one of the jobs that I do is I work with our child advocacy clinic here, and it is a clinic that cares for kids who are maybe having some problems at home, maybe you're being abused in some way. And so we had to kind of emergently have a meeting with the Office of Children and Youth and some other people to discuss a situation that was going on that we needed to just address everybody together collaboratively.
And that's one of the many hats you wear, I'm sure.
Yes.
So could you share with us what exactly does a CRNP do at UPMC Hamot?
Sure. So a CRNP, a nurse practitioner, has a lot of different options for what they do. at UPMC Hamot and really anywhere. That's kind of the beauty of our job, is we can have a lot of flexibility in what we do. So one option for people is to work in an office setting. So maybe in a family practice office or a pediatrician office or specialty office, maybe dermatology or neurology, things like that. Or they can work in the hospital setting as well. So the other part of my job that I do is I work with intensive care service here at UPMC Hamot. So we work in the ICUs, working alongside the physicians and physician assistants, taking care of the patients. So a lot of different opportunities for people to work in.
Okay, cool. So if you had to say on your day to day, what do you think your biggest responsibility is? Where do you spend most of your time?
So most of my time right now is spent working in our child advocacy clinic. I only work a couple shifts in the ICU a month right now. But I think my biggest responsibility right now is making sure that the kids that I'm working with are well taken care of and are going back home to a safe place. So that they have a good safety plan in place for them.
Yeah, that takes a special kind of person, without a doubt, to look out for specific characteristics. And so tell us a little bit about what you would say a CRNP, what would be somebody's interests that might align to, what abilities would align to somebody to work in your position? What would they need to value and have an interest?
That's a really good question. And I think that one of the nice things about this roles is it does lend itself to, lots of different values. I think that you're a nurse before you become a nurse practitioner. And so as you become a nurse practitioner, you definitely have a lot more autonomy. You're functioning on your own. You're making some more decisions on your own. And so you're spending maybe a little bit less time at the bedside. I mean, anybody who's ever been in the hospital, or even for, their tonsils out or something, the nurse is kind of a lot more at the bedside, maybe has just a couple patients, and maybe the physician or the nurse practitioners have a lot more that's going on and they're making a lot more of the decisions. So I think somebody that likes to have a little bit of autonomy, who doesn't necessarily need to function with like a big group of people at one time, well, there always is teamwork in healthcare. And I think that somebody who just likes interacting with people, and that can be one-on-one or in a bigger group, and somebody who is just interested in always learning, because, the pandemic, for example, every single week we're getting updates from, the University of Pittsburgh and the CDC and everything like that about what the new pieces of this pandemic COVID-19 puzzle are. So somebody who really likes to learn and never really wants to stop learning.
Yeah, definitely a characteristic that you have to have in healthcare. So let's go back a little bit. You said you had to be a nurse, a registered nurse, before you can be a CRNP. So share with us a little bit what it would require if somebody wanted to be an RN, or registered nurse.
Yeah, so there's a couple different options, which is really great. So you can enter the field as a nurse with an associate's degree. And so that's a 2-year degree, and you can start off as a registered nurse in that with that degree. And then a lot of places now are wanting people to go on and get their bachelor degree in nursing. And so the nice thing is that a lot of places, Hamot, St. Vincent, for example, provide some financial assistance for people to, go on and get that bachelor's degree. So that's really great. And the reason they want you to have a bachelor's degree is, nursing is a profession and there's a lot of other opportunities. So you may work at the bedside or in the ER or ICU for a while, and then you may decide that you want to work in leadership, or you want to do some research or education. There's lots of other opportunities. So you start off in those roles. And then to become a nurse practitioner, there's either a master's or a doctorate route that you can take.
Okay, so your CRNP is an advanced degree beyond that 4-year degree.
Correct.
So is there a difference between, forgive my ignorance here, but the 2-year associate's degree, is that an LPN?
It's not. An LPN is usually about 15 months. And so let me try to explain the difference a little bit, because it's a really good question. And I think a lot of people don't understand the difference. So a licensed practical nurse has all of the nursing foundations. They maybe don't delve quite as much into some of the physiology, so meaning how the body works, and the pharmacology, meaning how medications work. They don't dig quite as much into that as a registered nurse does. And because of that, they have some restrictions. They cannot give what are called IV push medications without some extra training. So, if somebody's in pain and we're going to give them a little shot of pain and their pain medicine in their IV, they can't give that. Sometimes they can't give antibiotics, and sometimes they can't give blood. And they usually are working in places where those things don't happen very often, such as a nursing home, a rehab facility, or they're working kind of in an assistant role. Some of the LPNs that work at the hospital here work out of the emergency department, and they help with all the admission process for patients. Once you become a registered nurse, then you can do all of those things, and you have a lot more options about where you can work. But they both are important roles. But there are places, I believe Mercyhurst has where you can go to get your LPN and then do a little bridge to getting your RN.
Your RN. Okay, so currently Hamot, and for those of you, we have a bunch of attendees from all across the state, potentially the country. UPMC Hamot is University of Pittsburgh Medical Center. Hamot is their Erie office. So currently at the Hamot office, you could obtain a position with a 2-year associate degree as an RN?
Yes, correct.
Okay. And then they would advocate and potentially provide some financial assistance for you to go back to school and get your RN as a 4-year.
To get your BSN, to get your bachelor's. Yep. So the RN, the registered nurse or the LPN is the license that you have. The degree would be an associate's of nursing or a bachelor's of nursing. Then
if you wanted to go beyond that, you would go back for your master's or your PhD, as Karin is a CRNP. We got that? Awesome, cool. So what do you think that your top skill is you need, whether it's entry-level skill, it's a people skill, what's the most important thing you need to know as a CRNP?
I think the most important thing is to know what you know and what you don't know, and to be not afraid to say what you don't know, because this is not a time to kind of fudge your way through anything. I don't know if that answers the question, but yeah, I think that is, and it's a little bit hard to get used to that, to like calling yourself out, being like, yeah, I really have no clue at all what is happening, or I have no clue what this is, or I have no clue what this means or what to do with this, and who am I going to get to help me figure that, or how am I going to figure that out? So that kind of mindset, I think, is probably one of the key things.
Yeah, not having too much pride to say, you know what, I don't know, but you're going to be able to find the answer, right?
Right.
Yeah, that's a great point. So in terms of like your people skills and bedside manner and healthcare, what do you think is an important skill, or AKA a soft skill, that somebody working in your profession would need?
So related to people skills, you mean?
Sure.
Okay, so I think related to people skills, you just need to be adaptive to different people's personalities and their needs. And, that does come with a little bit of time. It's really hard at first to kind of read people and figure out how to adapt yourself to them. And just being willing to have open conversation with people. I think that some other skills that are important are math, everybody's favorite, right? But I just, was thinking about that yesterday. Actually, I was calling in a prescription for a young child, and the dose has to do with like their weight and how often they're getting it and for how many days. And so I was sitting doing a little bit of some basic algebra on a piece of paper and reminded myself that I was thankful for that skill. So, and then just some interest in science. You don't have to be, the best at science in your class or anything like that, but you need to, at least have some interest and some basic understanding going in.
That's great. That's great feedback. So in terms of your profession, your role, what is something that you think our audience would want to hear? Something that maybe touched your heart, something funny, something really enjoyable, an experience that you've had while you've been in your role?
Ooh, that's a good question. Let me think for a second. I was thinking about this before we met. I think that some of the most rewarding things that I do see are when I work in the in the ICU, because we do see people who have just these devastating injuries that just do amazing. I've been working in healthcare for 16 years now, and seeing some of the changes that have happened are just amazing. And so it's really nice now when I do work in the ICU, for example, seeing people who are maybe in a devastating car accident or a work accident or have a really bad stroke, things like that, and we are able to help them recover and then really get to see them, doing well, where I know that 15 years ago when I started in this, we maybe would not have been able to help or save that person.
That would be really rewarding. Absolutely. So in terms of, and I'm going to throw this out to the audience, we're going to be transitioning here to our question and answer. So at this point, you guys can open up your question and answer, and and you can start firing those questions over. We have Ann Conti with us. She's our career readiness facilitator. And Karin, as any questions come through, Ann will be reading those to you. But talk to us about a little bit about when in your career or when in your life did you know that healthcare was the right choice and the path that you wanted to head down?
I'm glad you asked that, because it was not a completely straightforward path for me. When I was little, I thought that I wanted to be an orthopedic surgeon, actually. And I went to college at Allegheny College in Meadville, Pennsylvania, and I went for biology. And while I was there, I really fell in love with microbiology, which is studying like bacteria and viruses and stuff like that. And I completely changed my mind and thought that that's what I wanted to do as a career, which is very challenging to do as a career. But I got a job here in Erie right out of school doing that and in a lab. And that's when I realized that I didn't want to sit in a lab. As much as I liked it, it wasn't for me. I wanted to be talking to people, not petri dishes in front of me. My mom was a nurse in behavioral health for 35 years. And so I knew, that she had good experiences. And so while I was trying to figure myself out, I became an EMT and started volunteering with a fire department. And that's when I realized I really liked all of that. And I liked the adrenaline rush and, just interacting with people and trying to help them. So I got a job as what's called a PCT, which is like an aide in the emergency department at UPMC Hamot. And I worked that job while I was going to nursing school and getting, adding on that other degree, which if people do have a bachelor's degree in something else, there are programs to just add on a little bit more education for nursing. So I worked there, and then I worked in the ER at Hamot as a nurse for 7 years. The other part of my job where I work with the children through our children advocacy, and I also oversee our forensic nurses who care for people who are sexually assaulted or victims of domestic violence. I got interested in that about halfway through just because some of my friends were doing it. And I thought it was finally the perfect way to kind of tie in my science stuff that I liked, with being a nurse. And then I, just decided that I wanted to do a little bit more. And that's when I decided to go back and become a nurse practitioner.
So elaborate a little bit on that. Whenever I hear or see the term forensic, I automatically think of law and like crime. Tell me a little about your forensic coordinator. Tell a little bit more about that.
Yeah, so we at UPMC Hamot and in a lot of hospitals across the state have what are called forensic or SANE nurses. You may have heard either of those terms, maybe not, but they are nurses who have additional training to care for people who are victims of violence. So child abuse, elder abuse, domestic violence, sexual assault, and they function pretty autonomously. So for example, if somebody comes into the ER here at Hamot saying that they've been sexually assaulted, then the SANE or forensic nurses who, does all of their care, does their exam, collects their evidence kit, and works very closely with law enforcement. And so that nurse is functioning kind of in this role that exists between, a legal role and a nursing role. And a little bit of investigative piece and everything there. So I coordinate all the nurses here that do that. And there's nurses throughout the country that do that. Wow.
That's amazing. Ann, I'm going to turn it over to you. We have a question in the chat.
Yeah, I'm going to jump in with a question. Karin, also a Gator, so
awesome.
Go Gators, went to Allegheny. So the first question we have in the chat, can you talk a little bit about the main differences between a nurse practitioner and a physician's assistant?
That is a really, really good question that a lot of people have. So honestly, The difference is mostly just how you get there. That's like the main difference. But a physician's assistant usually goes to school for about 6 years straight through, and they go into school usually knowing that that's what they want to do. There are a few small differences. In our state, the way that a physician assistant and a nurse practitioner function are exactly the same. They can do all of the same things. In some states that is not the case. It used to be in our state that a physician assistant could not order blood products and could not do a death certificate. Kind of random, but but that's not the case anymore. Everything is the same. One of the biggest differences is that a physician assistant kind of gets this very general, gets a very general education and gets to kind of pick where they want to, spend a little bit more of their time training. And they do spend more time in some of the surgical specialties. So, like, for example, our orthopedic group here, usually they clump them together and call them advanced practice providers, but their advanced practice providers are usually physician's assistants because in school they spend time learning how to function in the OR and in the operating room and help with surgery. Where, like, in my program as a nurse practitioner, I didn't spend a single day in the operating room. So those are some of the little differences there. And a physician assistant comes out of school and is trained to and can care for any patient of any age in any setting. And then they can go on and add some little specialty certifications. For a nurse practitioner, you have to make a little bit of a decision before you go on. You can be a midwife, which many people have heard of. And once you go to school to be a nurse practitioner or midwife, that's kind of what you're set to do. You can do nurse anesthesia. So if you've ever had anesthesia, there probably has been a nurse anesthetist, it's called, at the bedside. That's also a nurse practitioner. Or you can do what's called acute care or family. And that just has to determine where you work. Are you working in a hospital setting or more in an office setting? So you do have to make a little bit of that decision ahead of time before you start school, whereas a physician assistant is getting everything and then maybe making some of that decision afterwards. But from function purpose and what you're allowed to do and what you do, it's not really that different.
Awesome. Thank you. I'm definitely learning a lot there because I would not have been able to identify the differences at all. So a couple of questions coming in, and I will preface by saying we recognize you might not be able to talk specifics about salary and things like that, but we do often get that question. So as best you can you identify kind of the pay and the difference at the beginning, median, and the advanced, maybe the room for growth within the career?
Yeah.
And this is a two-parter, so I'll start with that, and then I'll throw the second question at you.
Okay. So for a registered nurse with an associate, I was just doing the math really quick because I just double-checked this morning. Well, a registered nurse with an associate's degree usually starts off around $50,000, maybe a little bit more than that for an annual salary. And somebody with a bachelor's degree is probably a little bit more than that. A nurse practitioner job is going to vary a little bit, and depending on where you work and what the specialty is, same thing with a physician's assistant, and those usually start off between $90,000 and $100,000. One of the things I think is important is that, and I think this is important for everybody, even if you get a job right out of school, is looking at the big picture, because it definitely is more than just the money that is coming in your paycheck. There's a lot of other things that we get. We get help with continuing education. We get paid days off. We maybe get money to help with that. What education is your facility, your job providing for you? That's mandated. So if your job is mandating some sort of education, are they going to help you pay for it, or are they going to give you time off for it? So I think those kind of, and then obviously your insurance benefits and retirement is important as well.
Thank you. So the second part of that question was, let me find it. If you could talk about, Nick, did you dismiss that one? Let me go back to it.
I published it. I'm sorry.
All right. If you could talk about job stability and security, jobs available Is it in demand? And things along that line.
Yeah, so I think that's a really good question. There are always going to be healthcare jobs. I have seen that there have been some cuts of jobs with the pandemic, but I think that is a unique situation. Some places are not cutting staff, but are cutting how much they're getting paid because people are working less. But otherwise, I think that there is a nursing shortage. I know that they are hiring, a bunch of nurses here right now in multiple different locations throughout the hospital. And there's always going to be a role for, advanced practice providers and physicians as well. I think that there's always going to be job availability and some choice in where that job is.
Awesome, thank you. And we hear that a lot, that the demand in healthcare is going to be there. For sure. The next question, and I'm going to rephrase it a little bit. So it is, how long will it take to pay off student debts, which I know is variable from person to person, program to program. But if you could maybe chat a little bit about, is this a job financially that you have that stability to be able to make those payments, and the payoff is there in terms of being a sustaining wage and a family sustaining wage and such?
Yes, I definitely think that it is a family sustaining wage. I think that it is a wage that you can live comfortably at and still pay off your student loans. Some places do offer assistance with paying off your student loans, and some places do offer assistance with going back to school, so scholarships and things like that. I know that they say that they give $100,000 of scholarships out to staff every single year that are going back to school in some way. So there's a lot of scholarship opportunities. When it comes to paying it off, there's lots of programs that the federal government has that, for example, one is called the Public Service Loan Forgiveness, and it's a way that you can pay your loan and then it's forgiven after 10 years, depending on what setting you're working in.
Thank you. All right, and so we've got a couple more. Now they're coming in. So okay. What are the pros and cons of the company that you work for? Are there any certain settings or offices or workplace environments that you suggest?
I like the company that I work for. We're part of a huge hospital system, and I actually worked at this hospital before it was part of that hospital system. And I think there's a lot of support and technology when you work for a big system. I think that one of the good things that happens here is that they appreciate work-life balance, and that's really important. And so I think that when you're looking for a place to work, that's a really good question to ask that person is, if tomorrow, your dog died and you needed to take off a day, can you make that happen? Things like that. Or if you were sick, can you stay home? So I really appreciate that work-life balance for sure.
Yeah, I appreciate that about my job too. What advice do you have for high school students who are getting ready to graduate?
I think that my advice would be that if you don't know what you want to do yet, that's okay. And it's completely fine to change your mind. I work with people who are physicians even who decided when they were 40 years old that they didn't want to be, a machine worker anymore or something, or a nurse who maybe was working at General Electric and they got laid off and said, I'm going to do something completely different. So, don't be discouraged if you're not sure what you want to do. And then I think the other piece is, just whenever you go to college or, even now the support that you're getting, if there's certain things that you need to have to be prepared for the program you want to do, make sure that you are getting them. And again, making sure you're acknowledging the things that you are struggling in. So if you want to go into healthcare and math is just not your thing, making sure that you're willing to admit that.
Yeah, I think that's sound advice. Can you tell everyone how long it took for you to get the degrees that you have? So how much time you spent in education?
Yeah, so I'll tell you mine and then kind of more traditional. So I have my degree from Allegheny in biology, and that was 4 years. And then it took me 2 years going part-time to complete my second bachelor's degree as a nurse, because there's certain things that I had to have to sit for my licensing exam as a registered nurse. So the traditional way would be, to just go through and do 4 years to get a bachelor's. So 4 years. And then I have my doctorate. So my nurse practitioner program was 3 years full time. A master's program would be 2 years full time. And there's always a lot of options to do those things part time as well.
Awesome. Thank you. Our last question that we have here in the chat as of right now, what should a high school student do if they know that they want to be in the medicine field, but they're not sure what route or career they want to pursue?
I think that that's a good question and something that a lot of people struggle with. I think if there are opportunities to shadow places, you should. I know that it's a little bit challenging right now, but I think, for example, that I had the niece of somebody that I work with shadow me for 2 days, and she thought that she wanted to be a physician assistant or nurse practitioner. And then she said, actually, I think she said, I think I'm going to really just start with nursing. And I really liked that piece of things. And I just want to stay there for a while. And that's what I want to go to school for. But I think if you can shadow somebody, a nurse or a physician or advanced practice provider, we really interact with so many different people that you can really get a sense of what other jobs there are. People don't know that there's people whose job it is to run some of these like really advanced heart pumps that we have, for example, or somebody whose job it is just to be in the operating room running a heart-lung machine during, open heart surgery, or a surgical tech. And they have this expansive knowledge of every single instrument and everything that happens in the operating room, or a radiology tech. There's so many jobs. And so I think shadowing somebody where you can see all of those is really important. I think the other thing is that when you pick a school, if you still aren't sure, then, make sure that you are picking something where you maybe can just do like a pre-healthcare. A lot of places have that, where at least the first year you're getting some opportunity to get your basic classes done that you're going to need regardless of which route you take.
Awesome. Thank you. So a couple more questions came in, and if you have time, I'm gonna throw them at you. So the first one here, what has been your motivation?
Oh, wow.
I know.
My motivation, I think, has just been, it sounds kind of cheesy, but I think just knowing that I am helping people in a time when they are really, maybe having the worst day of their life. So, when I work with a forensic team or in our child advocacy clinic, something really awful has happened to those people. Maybe they were sexually assaulted or in a domestic violence situation. When people are in the ICU, that definitely is the worst, day and time of their life. So getting to feel like I am making some sort of difference and helping them recover. Maybe it's from a medical standpoint or from a, mental health standpoint, but that would definitely be it.
Yeah, that's a great answer and a great question to whoever asked
Yes.
that. It came through as anonymous.
Yeah.
So the next one, I'm going to maybe rephrase it too. Somebody asked, do you have to have a good GPA to enter the college you went to? But can you talk a little bit how academics are important to what you did and how your grades and your GPA are going to be important?
Yeah, grades and GPA are important. I'm admittedly a little bit unfamiliar right now with how many schools are requiring SATs, because I know that that's changed a little bit. But grades are certainly important, and grades in science and math and like English or writing, whatever your courses are called, are actually important as well. And so I don't think that you need to have, an A+ across the board, but I think you need to have, A's or B's as best as you can. I think that each school is going to be a little bit different. When it comes to graduate school, you usually have to take something called a GRE, which is like the SAT for grad school. And they really do some schools focus a decent amount on that, but everything in your career is going to matter. I know when I applied to graduate school, they wanted my transcript from Allegheny, which was from 12 years prior, is when I had graduated. And then I had a C in a science class, and I had to talk to them about why I got the C in that science class in college, in a chemistry class. So everything is going to be important. And it doesn't mean that if you have a rough time that you can't go back and fix it though, but whatever you can do to get decent grades, that would be good.
Yeah, and I think that's good advice, that we got to start working hard now, right? And it does matter. And I like the way you put that, that everything we do in our career matters, because it's so true no matter what you do. Absolutely. All right. So what is something that surprises people about your job?
Wow, that's a hard question, actually. I guess I'm not sure if they mean like what surprises them about something I get to do, or about
open to interpretation.
Okay. I think some people are surprised about some of the situations that I encounter in my job, and maybe in a good way or a bad way surprised. I think that people are surprised that I like my job sometimes, because it is, everybody says your jobs are all very sad. And, you know, but I think I like my jobs. I don't think that they're sad. I certainly can appreciate that. People would feel that way, but I always kind of say, well, I am not the person that's interested in, you know, like working in a nursing home, for example, but there's certain people who do, you know, love that setting, and they thrive in that setting. So I think people are surprised that I like my job, just because I encounter some weird situations.
Sure. Sorry, my computer just glitched for one quick second. So we do have a couple more questions coming in. And if you have time, we'll continue to ask them. So someone asked about where you see yourself in 5 to 10 years in your profession, or where do you feel like your profession will be in 5 to 10 years?
Oh, good question. So a nurse practitioner in general, I think the roles are going to continue to expand, and there will be more roles and more specialties as well. I mean, nurse practitioners work everywhere, but I think that role will just expand and grow. I think that there's going to be a lot more opportunity, easily accessible opportunity for nurses and nurse practitioners to do a lot more research and quality improvement type things, to really get into, you know, improving how medicine is working on the day-to-day basis. From a personal standpoint, I think I kind of see myself right about where I am right now. I like where I'm at, and I'd like to stay there right now.
Good place to be, right? What are some undesirable factors of your job?
Oh, that's definitely a good question. Obviously, it's undesirable that people die during my job. You know, I don't like that. That definitely was a big challenge to get used to. And anything in healthcare, you're going to encounter that. You know, really, no matter where you work, something can always happen. So I think that that's something we have to be prepared for. Everybody copes with it a little bit differently, and you know, maybe they choose where they work based on how frequently they're experiencing that. One of the biggest things about, you know, going from being a nurse to being a nurse practitioner is just there's a lot more responsibility, and you're doing a lot more things. So I wouldn't say that that's undesirable, but it's always something in the back of my mind, you know, how responsible I am when people are, you know, maybe you're having trouble breathing and we make them sleepy and put the breathing tube in their mouth and put them on a ventilator. That's a ton of responsibility. And so some people may find that that is not responsibility that they care to have, and that's completely fine. So looking at that piece of things. And then otherwise, I would just say sometimes it's a little bit of the schedule. You know, in any of my roles that I work in, I can't always predict, you know, how long somebody is going to be sick for, or, you know, somebody that I think it's going to be, you know, a simple interaction, it becomes very complicated. So, you know, it may say that I'm supposed to leave at 5 o'clock, but I may not get out until 7 p.m. Not every day, but sometimes.
Sure. And I think all good points for those out there who are considering nursing, and maybe which degree and which environment, all things to take into consideration. Do you have any suggestions for any programs for pre-med or nursing? It's okay if not.
I would say if you know, it's so hard to say this because right now everything is online. It seems like so much is online. But I honestly think that if you are interested in doing a nursing program that you find one that, at least for the associate's or bachelor's degree, you are doing a lot more in person. I think that I really recommend that. There's once somebody has an associate's degree and they're getting their bachelor's, there's loads of online stuff, and that's completely appropriate. And, you know, some of the nurse practitioner training is online as well. But I think for those first few years, you really need to find something where you can be in person as much as possible. Otherwise, I don't have I think there's lots of great programs throughout our state.
Yeah, but I think that's beneficial for at least what makes a good program. That's helpful information. So thank you. Well, that is the end of our questions. Nick, I'm going to throw it back to you as we wrap it up. But Karin, thank you, because there were a lot that came in there. So we appreciate you taking the time to answer.
Yeah, absolutely.
Yeah, that was great. Karin, thank you so much for connecting with us. And for those of you still on the call, we're going to have this recording posted to our website. So should you want to share Karin's words of advice, please feel free to do that. And Karin, I can't stress enough how much we appreciate your flexibility. I mean, your time is so precious in your profession. So
thank you guys for having me.
Thank you. And thank you for all you do. So we're going to go ahead and end this call. For all you that are still on the call, thanks for attending and good luck.